Well, a warm welcome to today's talk. Now, I'm going to give you the essence of this talk in about the first 4 or 5 minutes. And then if you want to watch the whole thing, you can. Now, it's based on this question here. This is from Sarah. John, please could you review this article from Israel's National News? It says the risk of myocarditis following mRNA COVID vaccine is around 133 times greater than the background risk. Is this true? And if it is true, why is it not all over mainstream media? Well, to deal with that last bit first, I don't know why mainstream media don't seem to report on these things more than they do. You would think it would be a legitimate part of informed comment. So I don't know the answer to that one. You'd have to ask the Director General of the various mainstream media outlets and their people in charge. But let's just clarify the question here. This is it here, new study, and it does say 133 times risk of myocarditis after COVID vaccination. And to answer this question, of course, because we have to just go by exactly what the evidence says, we have to go to the actual study here where this originated from. So this is the study this actually originated from, and it's in JAMA, Journal of the American Medical Association. You can download the PDF. It's all available free, which of course is very generous, and the whole thing is there. Now, to be fair, it's not a very easy read, so I'm just going to give you a sort of a quick pre-say of this, a summary of it, and you can decide whether you want to listen to the rest or not. Is there 133 times greater risk? It's actually probably much more significant than that, but what we know from the data, my calculations at least, it's 84 times increased risk in the higher risk category of young men and adolescents. Now, why am I saying it's actually 84 times the risk based on the data, but why am I saying it's probably more than 133 times the risk? In other words, that this is an underestimate of risk. Well, there's fairly strict criteria for diagnosing a case of myocarditis, and indeed pericarditis, so fairly strict criteria. So it's conceivable that some people have an inflamed myocardium, and therefore by definition myocarditis might not meet the criteria. That could be true of some cases. Many cases, of course, are simply not reported. People simply don't report the case. How many, we have no idea. Now, this is all based on VRAS data, the vaccine adverse events reporting system in the United States. And I've looked at this, and although it says that anyone can fill out a VRAS return, really you've got to be quite a specialist clinician to do it. I mean, I had to think about it, and I'll show you why it's complicated before. So we can conclude that there's an increased risk of myocarditis and pericarditis after the mRNA vaccines. We can say that definitely. Can we say that it's caused by the vaccine? Technically, the paper doesn't claim that. It says there's an increased risk after the vaccine. So you'll have to decide yourself whether it's a causal link or not. The paper doesn't claim it's a causal link. It just says there's an increased risk, which is patently the case. So if you want to carry on watching, do. It is pretty interesting paper. Now, myocarditis cases reported after that. That's the name of the paper there. US data from the 20th of December to August 2021. So there's a good few months of data there. That's good. Paper published just on the 25th of January. Now, I've just put this list of people in here so you can see where these people are working. This is a very prestigious source. So a lot of people work for the CDC, School of Medicine and Moore University, Children's Healthcare of Atlanta, etc. Pretty prestigious institutions, and a long list of authors. So this paper carries quite a lot of credibility. This is the actual reference that JAMA like you to cite, so I've done so. That's their actual reference. Now, this is important because vaccinations against COVID-19 provide clear public health benefits according to the paper, but vaccination also carries potential risks. So I think both fairly obviously true statements there to kick off. The risk and outcomes of myocarditis after COVID-19 vaccination are unclear, according to this paper. So they're actually saying that it's still unclear. That's why this needs clarified, which is, of course, is what they're attempting to carry out with this paper. Where am I? There we are. To describe reports of myocarditis and the reporting rates after mRNA-based COVID-19 vaccines in the United States. So that's what this is about. Now, it's a descriptive study. Reports from myocarditis to the Vaccine Adverse Events Reporting System, VERA. So it depends on this reporting, and it's a passive system. So if this complication comes up, or any complication comes up from the vaccine, people can decide to fill out this VERAS form or not. But as I'll show you, it's really quite a complicated form. And I know very often when drug complications are come across in the UK, it's actually quite a big job to report it. So sometimes it's just simply not done. So really, these VERAS returns are the minimum amount, and the real number could be much higher. But of course, I can't say that definitively. We don't know. We don't know how often these forms aren't filled out. We don't know how often they are filled out. After mRNA-based vaccine, so that's what this is about. Now, let's before we look at some interesting graphics, let's look at this. So it's between those dates, 20th December, 21st of August, in 192 million people older than the age of 12. But of course, we notice that of this 192 million, which is the whole number of people probably been vaccinated in this time period, many of these are much older than the age range in which myocarditis is likely to occur. So that figure, you could argue, is well, it is correct, but it's also remember, it's the younger demographic that's at risk of this. It's virtually unheard of at my age. This is typically people under 30 that are affected by this. So here we have some of the data here. So this is vaccination with BNT162b2, which of course is the Pfizer vaccine. So up and down here we've got reported cases of myocarditis after vaccination with Pfizer. Age at onset of myocarditis. So these are years. So for example, the highest rate here is people that are 16 years of age. And that was the number of cases with the Pfizer vaccine. Until we get to 40 years of age, when 39, 40, when there's actually very few cases, and they don't even bother putting the 50s and 60s and 70s and 80s because it is so uncommon, or virtually unheard of in those older age groups. So this is so important because we're dealing with young people here. And this is the number. This is the number for all young people. I'm pretty sure. Yeah, I think that's the number for all young people there. So, and this is after the Moderna vaccine. Now, if we just look at the scales here, so that was like 40, 60, 80. This is 20, 40, 60. We see many less cases with the Moderna vaccine. So more cases with the Pfizer vaccine. And again, age in years across there. Now, this is vaccination with Pfizer, and this is reported cases of myocarditis after vaccination, and this is days after. Now, this shows that you get a few cases on the first day, but most cases are occurring on the second day. Some on the some on the first day after, most on the second day after, third day after. So most of these cases are occurring, the vast majority in the first few days, but virtually all in the first 10 days. So this is shortly after the vaccine dose. More common, of course, after the second dose. And again, with the figures here for first of all, we notice that the numbers here. That's 200 line there. With the Moderna, that's the 80 line there. So it's less common with Moderna. But again, similar time after vaccination. Most common in the first few days after the vaccine has been given. Most common with the after the second dose. Now, during the analytic period, Pfizer vaccine 12 years and older, mRNA vaccines were being given to the Pfizer vaccines were being given to people 12 and older. The Moderna vaccines at this time were only being given to people 18 years and older. So during this time period, that is who were being vaccinated. So no one was getting no one between the ages of 12 and 18 were getting the Moderna vaccine during this time period. So that's what they were exposed to, those vaccines. Main outcomes and measures. Expected rates of myocarditis by age and sex were calculated using the 2017 to 2019 data, and that's how we get that number. So the expected number of cases of myocarditis was in that age group was taken before the pandemic, 2017 to 2019, compared to this 2021 time period when this data was actually collected. For people younger than 30 years of age, medical records reviews or clinicians' interviews were conducted to describe clinical presentations, diagnosis, etc. But of course, these were not always available. The full clinical details were not always available. They were in most cases, but not always available. So the result, now remember, amongst this 192 million people vaccinated, 354 million doses of vaccine, but most of these vaccines, of course, were given to people over the age of 30. So it's a bit misleading, that. So if we actually looked at the number of vaccinated people in that age group, it will probably be better, because, as we say, the older people are essentially at no risk of this complication. So a bit disappointing they didn't break that number down further, really. This would tend to make the cases look rarer than they are, because these are the cases for the whole population, not that particular demographic, which was unfortunate that they chose to express it like that. 1,991 reports of myocarditis. 1,626 met the criteria. Now, how many cases of myocarditis were there? We don't know. All we know is that many were reported on the VAERS system. The actual number of cases we don't know. Of those with myocarditis, median age 21, interquartile range, in other words, 50% fell between the ages of 16 and 31. So to be fair, 25% of cases there are over the age of 31. So it's not unheard of in slightly older age groups. Median time to symptom onset, as we said, was pretty quick, 2 days. Males, 82% of cases. Now, it's a pity, well, you could argue it's a pity that the adenovirus vector vaccines, which are associated with a much, much lower risk of myocarditis, were never rolled out in the States. Because it could be, when you actually add up the relative risk, that it's safer to give the adenovirus vector vaccines, like the Oxford vaccine, to young men. Because the young men are those ones most at risk, 82% of myocarditis cases, meaning that the other 18%, of course, were in females. So the vast majority of cases in young men, which of course is exactly what we don't want. Now, reporting rates for myocarditis. Within 7 days after COVID-19 vaccination, exceeded the expected rates of myocarditis across multiple age and sex strata. So, in other words, in any age group, there was more cases of myocarditis than would be expected, and in both sexes, there was an increased incidence. So, even in young women, there was an increased incidence compared to what had been expected in the years 2017 and 2018, or whatever the comparator years were. Rates of myocarditis were highest after the second dose of vaccine, which we've known for a long time. Adolescent males 12 to 15, 70.7 million doses of the vaccine given, and 70.7 cases of myocarditis per million cases of vaccine given. So nearly 71 cases per million vaccine given. And I've worked that out as one case in 14,144. But again, many of the people that were vaccinated were much older. And it's not clear, the paper's actually not clear whether it's just comparing within its demographic or for everyone. It's not really clear on that. Males aged 16 to 17, 105.9 cases per million doses. That's one case for 9,442. But if we just look at the demographic, I think that would be a fair bit higher, is my understanding, as my reading of this paper. Males 18 to 24.